So talking about the psychology of it is really important. And, I always come up with new words. So I came up with a word that I think should be adopted. I call it SPREAD, sexual performance related anxiety and depression.
Nice.
And we see that all the time. We get guys calling us on the phone, and it's not easy even to get them to admit this, because the average guy wants to say, "Oh yeah, I crushed it last night."
Yeah,
right. And it's a really difficult
She's still
thing.
complaining with her girlfriends about it.
It's a difficult thing for a guy to admit that and to talk about that openly. But that's the only way. When we do our consults, we try to really be sympathetic and really be
and normalize it.
Yeah, and normalize it. Be able to talk about a compassion, but also goal oriented, and we can help you with this. But the true spread, the anxiety, the depression, you have a night where you didn't perform well, the next day you wake up, the whole world seems like it's falling around you. Whereas the opposite is true. You get a great night of sex, you make her sing, you really enjoy, you connect, and not you make her come in a macho type of way. It's that you enjoy it as a couple. My God, the next day as a man, you can take over the world. Life is different. So that's what we want to bring to guys, is to be able, first, let's give you an objective way of measuring it.
Data, true data.
Second, let's come up with solutions. And the way we stack our solutions is by gradation, right? Now that we're going to use your device, we can get data. And then now we can go, whether you need testosterone plus tadalafil, plus nitric oxide, plus maybe the low acoustic wave therapy, plus maybe you do another ring constriction device, although it's a horrible name, but it still works. Or whether I'm going to tell you whether those patients go into getting PRP injection. Eventually, some patients need Trimix injection, penile injections, and eventually people need penile implants. What I tell my patients, there is from the least amount possible, you just do the ring or you lose weight, all the way to putting in penile implant.
And the cool thing
hold on, let me finish this point. You have a solution for all of this. I don't want anybody listening to this to keep suffering from ED. We have enough solutions that we can fix your erection, and that as a man, you can really now live a life where you feel that masculinity power is back. It changes you. So for the average guy listening to this, first, look at yourself and be honest. First, you need the FirmTech to tell you how many erections you have. Talk to your partner. Is it a sexual relationship that you're both happy with? And if it's not, get help. There's solutions for all of them.
And the cool thing is that we can give you that. The cool thing about the FirmTech is all those things that you mentioned, because we start with the lowest hanging fruits, right? It's like exercise, then it's nitric oxide, then it's Cialis, and the dosing. And with the FirmTech, we can give you correct data along the way, each step of the way.
That's
brilliant.
We're going to go there. That's where we're going to start now with solutions. Well, let me just echo on what you said about perfectly well said. This reason why all of this got manifested was my ED, as I told you, 18, but 22 really diagnosed myself. The point is, if you're in a relationship, you need to let your partner know somehow or some way, because from experience and from talking to many patients, since you don't want to deal with the problem and you keep putting it under the rug, what happens is you start shutting down and repressing your intimacy in a relationship. And it takes 6 seconds of kissing and 20 seconds of hugging to stimulate oxytocin. And if oxytocin is not being stimulated through intimacy, especially sexually, it will start to drive the partner away and maybe even looking somewhere else for it. So one of the things that personally helped me with other people that I never got the opportunity to let my partner know that there was an issue. It took off the silverback gorilla off my neck, that I can actually be at peace and that I was supported, because if you don't feel supported, there's even more stress to the issue. Okay, so let's move on because we're a little short on time to solutions. I'm going to go from the lowest hanging fruit to the most severe medical treatments. We can touch on each of them. I just want to say them. First of all, I had cock ring down the list. Now, because of your tech device, I have put it as number one.
Absolutely. Get a diagnosis.
Sleep. Start with tracking your penile erections to see what we're looking at. If you can't track it, you can't hack it. So,
well, imagine treating cock is disease with, hey, get a catheterization, and now we want to do a bypass. We're going to skip the electrocardiogram. We'll skip the CT angiogram. Let's skip the stress test.
Even for that, checking your nocturnal erections is saying so much about your cardiovascular function.
And I think it's cool, Ben, because it opens up the conversation, right? Like, how many guys, like, do you ever talk to your bar buddy? Hey, man, how many nighttime erections are you having? Like, no, we don't talk about this stuff, right? Like, we don't really say this stuff. Girls
should know.
Girls talk about this all the time with themselves, right? Like, we just don't have this conversation, right? So I think this is a cool thing, just as a culture thing, to really kind of, hey, man, you should get a cock ring, and it'll tell you a lot about your health. Look, Miguel has a totally different experience. He had ED at 18. That's why all of this came about. I've never had erection issues, and I've never had those issues, but I'll tell you that the insights that I've learned from just using the tech for a few days are amazing. Amazing.
So we'll touch on your FirmTech really quickly on the device so listeners can talk about it, because I'm in love with it.
Thank you.
So the FirmTech, then sufficient restorative sleep, proper nutrition, the proper supplementation like nitric oxide or glycocalyx if you have a damaged glycocalyx, PD5 inhibitors if necessary, peptides like bromolatide, P2141, melanotan 1 and 2, even for some, then acoustical shockwave, and then for some stem cells, PRP trimix, and the last resource is a penis pump implantation.
And in between hormone replacement, right? If you're testosterone.
Well, yes, I did leave hormone replacement.
You didn't mention girlfriend replacement. The one of these things about with shockwave therapy is we were a couple things. One, it takes a while to respond to shockwave therapy. But
It took me 18 sessions.
Wow. Well, we customers who are using our device, and it's not recommended by the doctor. They just bought it because the doctors don't know about it. They bought it to monitor their response to therapy. So they're able to see the recovery of nocturnal erections before they see an improvement in their sexual performance, and that inspires them to keep going with it.
For sure.
On the other hand, I've had 2 men contact me who quit their shockwave therapy because they had dead penis. They had no nocturnals. They was not going. Their vascular genetic disease was so advanced, was not going to benefit. And they would have wasted a lot of money and time. They needed an implant.
Yeah. And that's good.
The beauty
that's the beauty of it.
because
right?
you can, again, like, you are going through all of them.
Yeah.
A lot of patients sometimes when they talk, they're like, oh, I'm not willing to do this. Like whether you need the PRP, the shockwave, or eventually, like, look at those guys. You're like, guys, you have no nocturnal erections. Don't even waste your time.
Yeah.
A penile implant may be the answer. That's not what we want for our patients.
Yeah.
Our goal is to do everything but get you there. But if you're at that point, I tell my guys, it is what it is. When I talk to the urologist, a penile implant has a 95% satisfaction rate. So if that's what you need, that may not be what we wanted to, but if that's where you are, and then now you can measure it objectively with this.
And to echo that, like how many times do we? And we see this all the time, right? Guys go to their doctor. Their testosterone is what we consider low. Their doctor doesn't. He's like, oh no, you're just stressed out. It's all in your head, right? So with this, it's the same thing. Like be like, hey, use acoustical shockwave. You've been using it. Now you're frustrated because it's not working. Oh, it's all in your head, man. No, now you have an objective measurement so that you can track each therapy. Not get frustrated and not waste money.
We've had 2 men who were going to with whom implant was recommended to them. They had nocturnals though,
And they didn't need to do it.
And one of them talks about suing his doctor. I don't think that's appropriate. The doctor doesn't know about the TechRing, but that this is a very sophisticated guy who wanted to research everything before he had the surgery, and he had nocturnals. His
So it would have been an
issue
appropriate
was in a relationship.
Yeah.
Wow. And it would have been an inappropriate surgery because he does have nocturnal erections.
So this is groundbreaking. Nobody else has done this.
So let's go over and actually show the listeners what this device could look like and what it could do. So number one, I love that you match our company a lot with QR codes and videos, very technological, super easy. You open it, just scan the QR code. It tells you how to use it. Loved it from the moment I opened it.
Yeah.
Then
great packaging too.
Thank you. Yeah, great packaging. Then you get to the wearable device. I cleaned it, so don't worry about it. Come here, touch it.
It better be clean. It better be clean.
I feel like I'm touching Miguelito.
So no, for real. Let's be clear on this, because I want to discuss for certain men in different sizes. I mean, it fit me well. It wouldn't move.
It almost looks like a key ring with a
it's very
loop.
stretchy.
It's
I gotta
super
say
stretchy.
right away, Carlos already used it.
Yeah.
Very comfortable.
Very comfortable.
Very comfortable. It does it. I thought it would interfere with my sleep, and I'm like a freak about my sleep. Did not interrupt my sleep
At all.
Was very comfortable to wear, and then you have a little button on the side. Maybe you can give a little bit of the details, but let's see if I was a good student. Okay. So you're supposed to have, and I have 3 days. 1 day, unfortunately, got lost. I have 3 days of track data. You need 4 days of track data to have solid, to make an assessment, right? Then you need 3 to 5 nocturnal erections, and the score from 0 to 10, 10 being the strongest, hardest erection, you have to be above a 4. And the overall score that you want is 6 and above.
Correct.
I got
overall
9.2.
score.
Tell him I got
9.2. I don't know about his brother Carlos here.
Listen,
Wait,
I've only
how
had
do
data
you-
for 1 day. I had
Guys,
6.
start with the beginning. How do you put that on?
Yeah.
So,
go ahead.
yeah, you can. You're the master.
Yeah, so you remember people
So
are listening
when
to us.
this professor of urology challenged me to come up with a way of counting the number of nocturnal erections, and I thought, let's go for all of them, I had to reinvent the cock ring. So cock rings are these uncomfortable, hard silicone rings and made the same way for 150 years. I wrote one here. You can hear it. If you tap mine on the tabletop, you don't hear anything. So my first thought was we have to come up with a cock ring that will not block the arterial flow in, but only constrain the venous return. So the thought with cock rings previously was first you have to have an erection. Well, if you need a cock ring because you have ED, getting erections is already a problem. So there's a problem. And then it's essentially these little rings like it's like a noose for your dick. Who wants to hang their dick? Or or plumbing gasket. So ours is made out of soft elastomer. It can be worn for hours. It does not block the arterial flow, and a man can put it on discreetly when he's flaccid.
But even different sizes, because
Different
I mean,
sizes. Well,
it's not that I'm
it was
ginormous, but it was like any tighter. It was
designed to be one size fits all, and I guess if you're bigger than that,
Man.
no one wants you. Do you want to sleep with this guy? No, it gotta be. So we sold about 12,000 devices, and we have had 3 men say they were too big. We just returned it.
And what does this
two guys said they're too small.
So really, just so you see, you put the
you drop your balls in, and it wraps
can
around.
Can I ask you a question?
Yeah.
I didn't feel the necessity to drop my testicles in. I just wrapped it like this.
Well, you can do it that way because if you're really big, I don't know. But the reason
but I'm not. I was flaccid, and it was
me
perfect.
too. I didn't have any issue.
The idea about dropping the balls in is twofold.
You're
One,
banging hard.
we're all lean here. We all can look down and we can see our dicks. But a lot of men have their big bellies. It's a struggle for them to find the penis, especially men who have fat and the penises are attractive.
Yeah.
So the idea is to drop the balls in and then wrap around the shaft. But guys, the balls feel good to be touched during sex, don't they? So
When you're banging, I'm assuming you definitely need to wrap around the balls,
for sure.
because that's going to come up.
You want my wife calls it a brothel balls because what do women do who are not flat chested during sex? Well, they wear something to be pretty, but also to control their breasts. Rather, they're up, down, here, there. Right. And same thing happens to balls. They're up, they're down, here, they're not in a consistent location. So by wrapping it around the top of the testicles, we do two things. We hold the testicles in a consistent location. We prevent sensor artifact from the rotation, but we also hold a little more blood in the testicles, makes the skin more sensitive.
Okay.
Most guys dig it. I don't know.
Okay, so it could provide for more accurate data just for
the data
nighttime
right.
movement.
So yes. I actually recommend wrapping around the ball.
So let's talk about something. So that's the data. So it's great.
But again, just for the listener, it's super comfortable. Because I was like, dude, like Miguel, I'm very fanatic about my sleep. I'm not putting anything that's going to disturb me, and I don't want the thing to
the hook.
I don't want the thing to slip off, but. Super comfortable to wear, will not disrupt your sleep, and won't come off at night when you're moving around.
Right. And the idea for the hook came from the bra. Yeah. I would say probably half the success of heterosexual sex in a long-term relationship starts when a guy is scratching his girlfriend's or wife's back and takes a bra off at night because the bras are uncomfortable. They have a silicone band in the back, and silicone makes the skin adapt to it. Elastomers adapt to you. So I saw my wife's bra on the ground. I thought, what the fuck? Making cock rings the same stupid way of 150 years. It's hard rings. Why don't we make one open and close the hook? Because women don't put on bras over their head.
Super easy.
So, and then it holds about 9 to 10 hours.
Correct.
Right. So when you get up, you just press a button, hold it for 3 seconds. It turns off. You turn it back on. It uploads the data. I know your team is working on uploading that data a little faster because it takes a little long. So you have to be patient.
5-6 minutes.
And based on the undisputed world's greatest erection king, Dr. Elliot Justin says, you should be having sex how many times a day or a week?
I think you should have sex at least once a day, but at least twice a week. Oh, look, we doctors, I'm talking to the other doctor over here.
Wow.
We doctors make recommendations about diet.
Please don't tell that to my wife.
I know, man.
I'll write your prescription. But think about it. We
me
make
more
recommendations about diet, exercise, sleep, complying with medications. How come we don't make recommendations about sex?
Yeah.
Very true.
Yeah, very true.
That's
very true.
I mean, look at you. You look phenomenal.
You look phenomenal.
Super happy.
I mean,
so
dude.
whatever you're doing, you're like, that's sex. Sex keeps the doctor
Another
away.
thing I want to talk about the ring. So yes, it is a way to measure, to get data. But one thing we had talked about that's amazing. It is also at the same time
Pleasurable.
a constrained ring.
Yeah.
Because you compress it, your orgasm are a little bit delayed.
Yeah.
They are more forceful.
Prolonged.
Prolonged.
You're right.
It's not a constriction ring. It's an erection ring.
The erection, that's amazing. And one thing you were saying really good, it's when you put that on, you don't have the worry or the fear that if something happens, you lose your erection. I'm going to say that story. You'll say it, that you were having sex, you were helping. I love the way you are. And then you had to go do something downstairs in the garage.
Yeah.
Because you have the ring, you have no worry that, oh my God, by the time I come back, it won't be there.
Right.
So that takes a lot of the fear away. Because talking about like the psychology of ED again, think about a guy that's like, okay, my man, we're having a great girl today. Don't let me down. Make sure you stay up. You're talking like this all the time, right? Like you're going at it, you're like, ooh, yeah, it's good. She coughs, you're like, no. Don't go down. Come on. All guys have this going in their mind, right? And then that's going.
Yeah.
Now imagine you have something that no matter what, you're like, yeah, you want to go out, die, do a phone call with your girls, no problem. I'll be here waiting, standing up.
Bam.
Yes.
Love it. All right, guys, because we got to wrap it up, and I would love to keep talking to you for another 2 hours, Elliot. Let's just kind of add some thoughts, make it as quick as possible, and go through this list for the rest of the listeners, because we already, I think, killed it that you need to worm the FirmTech, right?
Yes.
Now, next one would be sufficient sleep. I think that without getting the proper sleep, nothing works, right? Could we all agree to that?
Yeah.
Proper nutrition. I mean, Twinkies don't come out of Twinkie trees. You need to eat wholesome, real foods.
Yes.
Do we agree to that,
Yes.
right? And we help you when you come to a clinic how to pick the proper foods, like there are essential versus non-essentials, right? And when to eat and what window of times to eat.
Yeah.
Anything else?
Correct. No, you're on it.
Supplements for not only for sexual health, but for you, Elliot, we're going to work on some longevity
Looking
supplements.
forward to it.
You want to be around for your grandkids for 120 years. We do focus a lot on longevity because at the expense of performance is your longevity because of mTOR activation. Something
And specifically for the listener, like when it comes to ED, I mean, nitric oxide is at the base of the supplements.
Right. And then glycocalyx for somebody who's had AFib or a heart attack or damage to the glycocalyx, which is what protects the endothelium. I don't know where I read something similar to this, but I loved it. The glycocalyx is like the frontline defense of a football team. The endothelium, the endothelium system is a quarterback, and the nitric oxide is the ball.
Yeah. Oh, wow.
So it's a great way of putting it. Then we have PD5 inhibitors like Viagra, Cialis, Levitra. Again, let's start with the lowest hanging fruit, nitric oxide.
Tested with the FirmTech,
Right.
see what works for you.
And if you have low testosterone, let's ramp up your testosterone production, and usually that will fix the issue. If not, we'll add a PD5 inhibitor.
Yeah.
Low dose always, that's what we like. Then peptides. As we said, we have PT141, which works on your central nervous system rather than causing vasodilation. Anything else you guys want to add there?
No.
Okay, and then acoustical shockwave therapy. I truly believe in this. This is the oil change to your penis. If you're 70,
Don't get the pressure. I don't believe in it. I just believe we should be getting data before and during.
And after.
I agree, but personally using it, I've seen phenomenal results, and it's breaking down the plaque. I mean, it even gives you an erection. It's a toy, I bet. If you haven't tried it, Ellie, you should definitely try it. And then the least favorites, but if they're necessary, guys, what we're trying to tell you, there is hope, period. And like from our experience and working in the industry, there's hope, even if it's the ones that I'm about to tell you, which is using PRP, stem cells, trimix, or the worst case scenario is a pump penile,
which has a 98% satisfaction rate.
So in the end, there's a solution, guys, and it's about getting down to the solutions, right? Yeah. So King on the erections, Dr. Elliot, is before we close out, is there anything that we may have left out that you want to leave the listeners with?
Well, I'd summarize it this way. One, it's great to be working with you because I believe in your approach, and I appreciate the integrity of your approach of trying to address things scientifically, as opposed to saying, here are 200 things, take them all.
See what sticks.
Right. But we spoke a bit about work-life balance with these things like nutrition and supplements. I like to talk about work-life, sex balance, and I want that should be part of people's expectations and part of the healthy lifestyle. Yeah. Finally, put a ring on it.
Put a ring on listen, I'd like to personally thank you just because, you're kind of sort of trailblazing this area. And I think what your technology will do is bring the conversation, right? Make it normal for guys to communicate about this because, it was tough for the last 10 years to develop a comfortable place where guys can come and open up about this. It's not an easy conversation to have. Luckily, we've mastered it. But this is just an added bonus for us to help people be like, hey, listen, let's not even talk about it. Just put a ring on it and let's see what the data comes back. So thank you for that because I think you're changing culture in the sense that it's going to normalize talking about it. So
next up, we have a device for women.
Oh, you'll come back with that one. You'll come back.
That's what I definitely wanted to go over this. Is
women, we haven't forgotten about you.
We have to talk about the women. It's amazing that you're coming up with a device that's going to help with women also.
That'll be part two, actually.
Yeah, be part two.
Part two. Very good. Well, guys, I think that wraps it up for today. I think and hope that you guys have gained and learned as much as we have from this talk today. And if you're interested in Dr. Elliot Justin FirmTech wear device information, his information about his company will be on the link below. And if not, just call us and we'll point you in the right direction. And for now, listeners, stay healthy.
And God bless.
Stay firm.